How does HPV affect LEEP procedure decisions? Understanding how human papillomavirus influences decisions about the LEEP electrosurgical excision procedure can seem complex, but it's rooted in solid science. To start, cervical cancer screening involves Pap tests and human papillomavirus testing. These tests help detect abnormal cells and identify high-risk HPV types, especially types 16 and 18, which are responsible for most cervical cancers. When screening shows high-grade cervical intraepithelial neoplasia, or CIN, further evaluation is needed to prevent progression to invasive cancer. The LEEP procedure is a common way to treat high-grade CIN. It uses a thin wire loop with electric current to remove abnormal tissue from the cervix. This procedure helps both diagnose and treat precancerous changes. Usually, one LEEP is enough to remove the abnormal cells, and healthy tissue grows back in its place. But HPV plays a key role in guiding how and when this procedure is done. Before LEEP, testing for high-risk HPV helps identify women at greater risk for persistent or recurrent CIN. If high-risk HPV is present, especially alongside abnormal Pap results, your doctor will likely recommend a colposcopy, which is a closer look at the cervix, and possibly a biopsy. If high-grade CIN is confirmed, a LEEP is often the next step. This is because removing the abnormal tissue can prevent it from turning into invasive cancer. After the LEEP, HPV testing remains important. If HPV is still detected after the procedure, even if the edges of the removed tissue are clear, the risk of CIN coming back is higher. Studies show that when HPV clears after LEEP, the chance of recurrence drops significantly. But if HPV persists, the risk of abnormal cells returning increases. This is why ongoing monitoring is vital. Margin status also influences decisions. If the edges of the removed tissue contain abnormal cells, called positive margins, there's a higher chance some abnormal tissue remains. However, even with negative margins, persistent HPV after LEEP raises the risk of recurrence. So, HPV status is an independent and important factor in predicting future issues. Follow-up care after LEEP usually involves repeat Pap tests and HPV testing at intervals recommended by your healthcare provider. Persistent HPV may mean more frequent checkups or additional treatment. It's also worth noting that you can acquire new HPV infections after LEEP, so vaccination against HPV remains recommended. Vaccines can protect against types not previously encountered, reducing future risk. For patients, understanding this relationship emphasizes the importance of HPV vaccination and diligent follow-up. Vaccination can help prevent future infections, even after treatment. Regular testing helps catch any recurrence early, and it's important to remember that LEEP effectively removes abnormal cells but doesn't eliminate the virus itself. HPV can stay in the body, so ongoing monitoring and vaccination are key parts of long-term health management. While HPV is linked to cervical and other reproductive cancers like vulvar, vaginal, anal, and some oropharyngeal cancers, it's not associated with testicular cancer. The focus here is on cervical cancer, where screening and procedures like LEEP are proven to reduce cancer risk. Early detection through screening and appropriate treatment can save lives, and following guidelines from health authorities ensures the best outcomes. In summary, HPV status significantly influences decisions about performing a LEEP. Detecting high-risk HPV before treatment helps identify who needs closer follow-up. Persistent HPV after the procedure indicates a higher chance of recurrence, making regular testing essential. Vaccination remains a powerful tool to prevent future infections and protect long-term health. Always consult your healthcare provider for personalized advice, as individual risk factors and test results guide the best course of action. Remember, staying informed and proactive is your best defense against cervical cancer.